ORSERDU Patient Portraits. Perspectives on a patient with ESR1 and PIK3CA mutations. Marcela Mazo Canola, MD. Indication: ORSERDU elacestrant is indicated for the treatment of postmenopausal women or adult men with ER-positive, HER2-negative, ESR1-mutated advanced or metastatic breast cancer with disease progression, following at least one line of endocrine therapy. Select important safety information. The labeling for ORSERDU contains warnings and precautions for dyslipidemia and embryo-fetal toxicity. The most common serious adverse reactions in patients who received ORSERDU were musculoskeletal pain and nausea. The most common adverse reactions, including laboratory abnormalities in patients who received ORSERDU, were musculoskeletal pain, nausea, increased cholesterol, increased AST, increased triglycerides, fatigue, decreased hemoglobin, vomiting, increased ALT, decreased sodium, increased creatinine, decreased appetite, diarrhea, headache, constipation, abdominal pain, hot flush, and dyspepsia. Full important safety information will follow this video.
We're happy because this medication has been in the market since January 2023, and I've had the opportunity to treat some patients outside of a clinical trial with ORSERDU, and I'm happy to report that my patients overall have done well. The tolerance of the medication has been remarkable for my patients. The efficacy of ORSERDU is impressive for my patients with ESR1 mutation, and it helps me drive my second-line treatment decisions. In the EMERALD trial, ORSERDU doubled the median progression-free survival for patients with ESR1 mutations from 1.9 months with standard of care endocrine therapy to 3.8 months with ORSERDU. In my opinion, it's important to take into account the duration of the response that the patient had on CDK4/6 inhibitor to find that candidate for ORSERDU. We know based on the results of the EMERALD trial that in patients that have that ESR1 mutation identified by liquid biopsy, the longer that they are on their initial line of endocrine therapy with CDK4/6 inhibitor, the better that progression-free survival is going to look in that patient population. To share a clinical case, I had one of my patients with metastatic hormone receptor positive, HER2-low breast cancer who was started initially in therapy with a CDK4/6 inhibitor and a aromatase inhibitor. This patient had evidence of disease progression after 15 months of her initial therapy with CDK4/6 inhibitor and endocrine therapy. At that time, we decided to do a liquid biopsy, and the patient was found to have an ESR1 mutation and a PIK3CA mutation. After having a discussion about the options with the patient and taking into account her duration of response to her initial CDK4/6 inhibitor, we decided to start the patient on treatment with ORSERDU. In the particular case of a commutated patient, there is data, and I'm referring especially to the post-hoc analysis that was published on October of 2024. We have now the data to back us up in the sense that even in those patients that are commutated, ORSERDU has shown that it's still effective as in those patients that only have an ESR1 mutations or patients that perhaps has less disease burden. The results of the post-hoc analysis of median progression-free survival by duration of CDK4/6 inhibitor and hormonal therapy are observational in nature and should be interpreted with caution. There was no pre-specified statistical procedure controlling for type 1 error. ORSERDU is not indicated to target PIK3CA mutations. I think the post-hoc analysis gives me the reassurance that the commutated patients, in that patient population, this medication continues to be effective despite our fear, and I put it in quotes, of not having an agent that was, let's say, strong enough to attack the disease in those patients. I think if anything, for me as a medical oncologist treating breast cancer patients, it gives me the reassurance that I'm taking the right step by offering effective treatment backed up by science. In my opinion, ORSERDU is becoming the standard of care for patients that have an ESR1 mutation. There is no question about that. And the data that we have to back it up, especially in those commutated patients, I think is making a stronger case for us in the breast medical oncology community to be the standard of care.
Indication: ORSERDU elacestrant is indicated for the treatment of postmenopausal women or adult men with estrogen receptor, ER-positive, human epidermal growth factor receptor 2, HER2 negative, ESR1 mutated advanced or metastatic breast cancer with disease progression following at least one line of endocrine therapy. Important safety information. Warnings and precautions. Dyslipidemia. Hypercholesterolemia and hypertriglyceridemia occurred in patients taking ORSERDU at an incidence of 30% and 27% respectively. The incidence of grade 3 and 4 hypercholesterolemia and hypertriglyceridemia were 0.9% and 2.2% respectively. Monitor lipid profile prior to starting and periodically while taking ORSERDU. Embryo-fetal toxicity. Based on findings in animals and its mechanism of action, ORSERDU can cause fetal harm when administered to a pregnant woman. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Advise male patients with female partners of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Adverse reactions. Serious adverse reactions occurred in 12% of patients who received ORSERDU. Serious adverse reactions in greater than 1% of patients who received ORSERDU were musculoskeletal pain, 1.7%, and nausea, 1.3%. Fatal adverse reactions occurred in 1.7% of patients who received ORSERDU, including cardiac arrest, septic shock, diverticulitis, and unknown cause, 1 patient each. The most common adverse reactions, greater than or equal to 10%, including laboratory abnormalities of ORSERDU, were musculoskeletal pain, 41%, nausea, 35%, increased cholesterol, 30%, increased AST, 29%, increased triglycerides, 27%, fatigue, 26%, decreased hemoglobin, 26%, vomiting, 19%, increased ALT, 17%, decreased sodium, 16%, increased creatinine, 16%, decreased appetite, 15%, diarrhea, 13%, headache, 12%, constipation, 12%, abdominal pain, 11%, hot flush, 11%, and dyspepsia, 10%. Drug interactions. Concomitant use with CYP3A4 inducers and/or inhibitors. Avoid concomitant use of strong or moderate CYP3A4 inhibitors with ORSERDU. Avoid concomitant use of strong or moderate CYP3A4 inducers with ORSERDU. Use in specific populations. Lactation. Advise lactating women to not breastfeed during treatment with ORSERDU and for 1 week after the last dose. Hepatic impairment. Avoid use of ORSERDU in patients with severe hepatic impairment, child PIK3CA. Reduce the dose of ORSERDU in patients with moderate hepatic impairment, child PIK3B. The safety and effectiveness of ORSERDU in pediatric patients have not been established. ORSERDU is available as 345 mg tablets and 86 mg tablets. To report suspected adverse reactions, contact Stemline Therapeutics Incorporated at 1-877-332-7961 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including patient information.